Hello, everyone. I have the duty now to bring us back on time. I will speak in reverse. Yeah. I'm very happy to be here. Thanks for inviting me. I will talk about a new tau biomarker in blood. And the title of the presentation is phospho-tau in plasma, the next NfL, and I didn't make up this title. So it's, but the reason for the title is when we discussed the results, the impression was a little bit like when we saw neurofilament light results in plasma and serum for the first time. That wow, this looks good. So that's it's not the next NfL from a biochemical standpoint. This is just showing what this will focus on. We have been working a lot on axonal injury markers, and we started regarding tau. We started to make a total tau assay in collaboration with the Quanterix people just after the email Kai mentioned. So then we went to Cambridge and visited the first facility. And just referring back to what Tyler said about naked instruments looking a little bit dodgy, it was a little bit like that also in Cambridge. It was this first version of what's now the HDX, but HD1. It was a naked instrument with lots of arms moving, and we could look into, and we tried to, and it stopped, and but it worked. I mean, the basic principle worked. So those of you who are from investment sides and think about new investments in startup, don't be afraid if someone shows you a naked instrument. I mean, it really shows this transparency thing we are talking about also. But then, of course, what one needs to do is this type of validation with analyzing samples that are blinded and getting results back and looking at quality QC measures and so. So that's what we did. If we look at total tau, we have been interested in it as a biomarker for Alzheimer's disease. In cerebrospinal fluid, the data are super concordant. Elevated total tau goes with Alzheimer's disease, and that's the same for phospho-tau. So we made this first version of the CMO assay together with Quanterix, getting a very nice broad range in the standard curve. It became an extremely sensitive assay, the first version. And then we started to look in cardiac arrest and saw very dramatic increases. Those were the blinded samples that we started out with. But then we moved to Alzheimer's disease. And now you see less promising data. You see a group difference in plasma total tau levels in Alzheimer's disease patients, but you see that the overlap is it's not a useful clinical diagnostic test. So this was the first study we did, and then we also did the ADNI samples using the same version of the assay. And then it looked almost worse. So it was definitely not a diagnostic test. But we saw this Alzheimer's disease dementia-related increase. But of course, we were disappointed. We needed to continue to work. The assay works beautifully, but the biomarker doesn't work that well in blood. There are also interesting differences in half-life of total tau in plasma compared to blood, the way we measure the biomarker. Because if we look in acute conditions, we see rapid increases in total tau within hours, and then it disappears with a half-life of 10 hours. So it works in acute conditions, but the half-life in plasma, the way we measure it here, is 10 hours. In CSF, it's 21 days. So it's definitely two different, I mean, most likely total tau is chopped into pieces in blood, and thereby we lose the signal. So it's cleared. In the first study, we saw no correlation between CSF and plasma tau levels. As you can see here clearly. In the ADNI cohort, we had a very good statistician who found this strange positive correlation, which is highly significant. Of course, completely meaningless, but anyhow. So we continue to work on this. And so we have been working with plasma phospho-tau lately now. Tommy Karikari in our team has been working on this assay. You see the standard curve to the left, and to the right you see that this assay is specific to tau phosphorylated at amino acid 181, which is sort of the standard CSF test. Here are the results. This is one of the first studies we did on samples from our collaborators at McGill University. And here we see meaningful changes. You can see this quite clearly. So to the left you see young controls and then a little bit older controls in blue, and then you see MCI patients and Alzheimer's disease patients. And now we see differences that to me look super promising. If we go to this is another cohort where we compared amyloid positive versus negative individuals. And here again, you see very nice differences. If one looks at the other blood biomarker for amyloid positivity is, of course, the beta 42 to 40 ratio. That is reduced by 14 to 15, 16%. So it's really a small, and with a rather big overlap. You can get a EUCs around 0.80. But here now you see a twofold increase. I mean, that's, to me, this is something that one probably could make into a test that could work clinically also. And you can measure it in either serum or plasma. This is yet another cohort, again together with our MacDill collaborators. To the left, you see frontotemporal dementia patients. We know that they are normal in CSF total tau, even if they have tau positive FTD. And you see this is reflected in the blood. And then you see the other young controls who definitely do not have Alzheimer's pathology. Then you see elderly controls, MCI, and AD patients. And you see that the AD patients are really up. And you see there's no overlap between FTD and AD. So in a memory clinic, you could, just by a blood test, rather well differentiate FTD from AD. We should do a study on frontal variant of AD, because that would be a clinically important thing. If the biomarker could separate those two, that would be wonderful. And here you see correlation with tau PET imaging. And I would just point towards that if you interpret this graph and look at the red ones, they have elevated plasma phospho-tau. And the rightmost panel indicate those with where you see the most severe tau pathology. So it's really like phosphorylated tau goes up and predict the more severe tau pathology, leading to this clustering of the red dots in the right part of the panel. And here is just these are data that we got just right now. So if Tommy is in the audience, he hasn't seen these unblinded. So we got samples from the London Family Lady cohort some weeks ago. And then we are still unblinded to the mutation status. But we can see if they are controls mutation carriers. And you see in the to the right, we see, now I say right here because I got this yesterday. Yeah, the controls are to the right. And then you see preclinical mutation carriers next to the controls. And then you see the symptomatic mutation carriers. So it really shows that this pinpoints onset of neurodegeneration or tau pathology in or dysfunctional tau metabolism in familial Alzheimer's disease also. So with that, I hope that I brought us back a little bit. We think plasma phospho-tau has an excellent analytical performance on Simoa. It has a strong correlation with CSF phospho-tau, strong correlation with tau PET. Not a linear correlation really, but really nice associations and a predictive marker of tau pathology. And it has a greater fold change between A beta positive and negative subjects than plasma A beta 42/40. Positive in pre-dementia stages of AD, increased in familial AD mutation carriers that enter symptomatic stage, and there is no overlap between AD patients and FTD patients. Thank you very much. Oh. I forgot the acknowledgements. So this is from the bar yesterday evening. The guy in the middle is Tommy. There he is, he stands back there. And then this is the team at MacDill with Pedro Rosaneto's team. Thank you.